in order to replicate the Eucharistic miracles, one would need to take tissue from a patient who has type AB blood. Second of all, it would have to come from human heart tissue in a patient who has some sort of inflammatory pathologic process going on in the heart. Furthermore, it would only be able to be a small biopsy or portion of heart tissue removed. One can't take a large chunk of heart tissue from a living person without killing him or her. And then lastly, one would have to preserve that tissue in formalin or formaldehyde so that it would not deteriorate over days, decades, hundreds of years. And then one would have to take that tissue that has been preserved, that has been taken out of a patient, that has the exact right blood type, and then place it on top of a host. That would be, frankly, as miraculous as the miracle that we're examining here.
Wow, that is amazing. We are here with Dr. Jason DeGregorio. Doctor, thank you for coming on to speak about this topic from a pathologist perspective.
Thank you very much for having me, Ray.
Could you tell us a little bit about yourself?
Yes, my name is Jason DeGregorio. I'm a medical doctor with an MD, and my area of specialty is pathology. So I'm a board-certified anatomic pathologist, and I have subspecialty boards in neuropathology, and I work in a hospital in Southeast Florida.
Awesome.
And just a brief word for those of your listeners explaining what a pathologist does. A pathologist is a doctor who looks at tissue both grossly and microscopically and makes diagnoses. So the pathologist is the doctor who is diagnosing the specific disease, and it is generally a surgeon or a radiologist who's taking a biopsy or resecting or surgically removing an organ.
All right, well, I brought up white blood cells in my video quite a bit, and I'm sure people are wondering what those are. Could you explain that for us?
Sure. So to start explaining that, I think the best way to look at it is kind of giving an analogy. I look at the white blood cells as so-called warriors or defenders in the body. So white blood cells are designed to, in a special way, go to areas that have had some sort of injury to them, and they are sent as the sort of both warriors and ambulance EMTs, if you will, to provide support to the area of the body that's been injured. And these little warriors and or EMTs travel through a fluid highway in our bodies, which is the cardiovascular system. So the blood vessels through our body, they provide the so-called fluid highway for these little warriors and or EMTs to travel to a site in our body that has been injured.
Great, so you'd only find those in an area where trauma has occurred?
That is correct. So, for example, we will be talking today about one of the Eucharistic miracles and specifically focusing on cardiac tissue. When a pathologist looks at normal cardiac or heart tissue, the pathologist would generally only expect to find white blood cells within the blood vessels. And again, using our analogy, the blood vessels are the fluid highway that these white blood cells would normally travel in. So essentially they're on high alert, if you will, on the highway, ready to take off a side road if there's an injury in a tissue. So as a pathologist, when I look at autopsy tissue, if I'm looking at heart or cardiac tissue of someone who has died, under normal circumstances, if the heart muscle and its tissue is healthy, I would only find a few white blood cells within the blood vessels themselves. I would not expect to see inflammatory cells outside of the blood tissue within the so-called myocardium or heart tissue itself, the actual muscle of the heart. So again, under normal circumstances, in normal heart tissue in a living patient or in a patient who's died, who has not undergone some sort of pathologic process to the heart, we would not expect to see white blood cells, again, within the myocardial or heart tissue proper. They would only be within the blood vessels. When we see inflammation in the heart or myocardial tissue, that indicates that some sort of pathology has occurred. There are different types of pathologies. For example, if a trauma has occurred, for example, if somebody is struck over the chest, this could cause rupture of the blood vessels, which would result in hemorrhage within the tissue, but also the white blood cells that are traveling within the blood vessels, they would be released into the surrounding tissue abnormally. Additionally, if there were an infection in the heart, for example, certain bacterial infections can result in inflammation of the myocardial or heart tissue.
So then it is pretty surprising to find white blood cells in the heart, correct?
That's correct. So in a heart attack, in the acute phase of a heart attack, after roughly 12 hours, one begins to see neutrophils, which are a type of white blood cell. They're an acute inflammatory white blood cell. Neutrophils are released into the area of damaged heart tissue because they're involved in the repair of that area. Eventually, over several days and weeks, a scar will eventually result in that area. But the initial acute or immediate inflammatory reactive phase involves release of neutrophils from the blood vessels into the surrounding tissues.
Okay, so you've seen some of the slides of the tissues from these Eucharistic miracles and may have heard the stories. Many people think it would be simple to replicate these miracles or miraculous tissues. From the pathological perspective, what would it take to replicate these?
So in order to replicate the Eucharistic miracles, one would need to take tissue from a patient who has type AB blood. Second of all, it would have to come from human heart tissue in a patient who has some sort of inflammatory pathologic process going on in the heart. Furthermore, it would only be able to be a small biopsy or portion of heart tissue removed. One can't take a large chunk of heart tissue from a living person without killing him or her. And then lastly, one would have to preserve that tissue in formalin or formaldehyde so that it would not deteriorate over days, decades, hundreds of years. And then one would have to take that tissue that has been preserved, that has been taken out of a patient, that has the exact right blood type, and then place it on top of a host. That would be, frankly, as miraculous as the miracle that we're examining here.
Wow, that is amazing. Well, doctor, those are all my questions. I appreciate your time. It's always great to hear from the experts, so thank you for making time for this. We really appreciate it.
Thank you very much, Ray. I appreciate your having me.